for this session. Wanted to see if you all can hear me and see me.
They can hear you and they can see you, Dr. Khan.
Perfect. I'll go ahead and share my screen. Okay, can you see my screen? See the slides?
Yeah.
Perfect. Okay, so we're going to be talking about some do's and don'ts of residency interviews. This talk is geared for medical students who are applying for residency soon, and also for foreign medical graduates. Let me tell you a little bit about our organization first. So this session is being conducted by the American Muslim Women Physician Association. This is a non-profit professional charitable organization. And I have the website link over here, amwpa.org. I do encourage all of the participants to go ahead and look at the website pages. There are options to volunteer for this organization and participate actively if you're a working physician here. And if you are looking for residency or other volunteering opportunities like helping with health fairs, and also with, for example, students can even apply for some merit scholarships through this organization. So I do encourage everybody to go ahead and check the website and get more information on our vision and our mission and the excellent work that members of this organization have done in the past. Our vision is briefly stated here. We as an organization want to promote health, welfare, and education of women, and also men. We started off with helping women, but we are all inclusive, and we include women, men, and children as well. The mission for AMWPA is to improve the condition of women's health, to provide a platform for Muslim women in medicine, and to raise awareness of issues regarding community welfare. And we do that through different drives and health fairs and other work. We will get started now, and I will briefly recite verses of the Quran, the first few verses of the Quran, in fact, which are some of my favorite. Iqra, bismi rabbika allazi khalaq. خلق الإنسان من علق اقرأ وربك الأكرم الذي علم بالقلم علم الإنسان ما لم يعلم. Read in the name of your Lord, who has created all that exists, has created man from a clot. Read, and your Lord is the most generous, who has taught the writing by the pen, has taught man that which he knew not. And with that, we will get started. First, we will have introduction of our faculty. And let's get started.
Assalamu alaikum, ma'am.
Yes. Yes, you have a question? Okay. So, so I will have the presenters introduce themselves. So let's start with Dr. Zaiba Jetpuri. She is the program director for family medicine residency at UT Southwestern.
Assalamu alaikum. So thank you so much for the introduction. Yes, I'm the residency program director at UT Southwestern for family medicine. I've been in academic medicine pretty much my whole career since I graduated from residency. Originally went to medical school at TCOM and UNT, Fort Worth, and then did residency at Southwestern, where I'm still here. Thank you for having me.
Next is Dr. Faisal Masud.
Assalamu alaikum, everybody, and welcome to this fantastic session. I hope it'll be exciting. My name is Dr. Faisal Masud. I'm the endowed chair in anesthesia and critical care and medical director of Center for Critical Care. I'm a professor at Cornell. I'm a professor at UT Houston. I'm a professor at Texas A&M, and I'm a professor at Institute of Academic Medicine. So I'm like most of you, international medical graduate. The only difference is I came here about 34 years ago. So slightly older than, but looking forward to engaging with you and having a good session. Thank you.
Next, I will ask Dr. Mehreen Khan to introduce herself.
Assalamualaikum everyone. My name is Mehreen Khan. I'm currently doing my fellowship in Consultation Liaison Psychiatry at UT Southwestern Dallas, Texas. I just graduated from my psychiatry residency at John Peter Smith in Fort Worth, Texas. So I'm very early career psychiatrist. I am also an international medical graduate. I graduated from Foundation University Medical School in Islamabad, Pakistan. I'm honored to be here.
Thank you. And next, I will ask Dr. Madiha Khan to introduce herself.
Welcome, everybody. I'm a second-year cardiology fellow at Houston Methodist DeBakey. I also did my residency here 2 years ago. And then before that, I did medical school in Virginia at Liberty. So I'm so excited to be here and talk to you guys about residency interviews.
Thank you. And let me briefly introduce myself. I am Safia Khan. I went to med school in Pakistan. I did family medicine residency training at Texas Tech El Paso. And then I moved to Dallas for fellowship training in sleep medicine. And I stayed on board as faculty at UT Southwestern. I recently took on the role for program director. So thanks everybody for joining us, and I will share my slides again, and we will get started on some important topics pertaining to residency interviews.
मैम आवाज नहीं आ रही मैम आपकी आवाज नहीं आ रही
Okay, so I'm hearing comments that you guys cannot hear us. I think you will have to turn up your volume. I do hear the participants very clearly. And also I would like you guys to use the chat more than muting yourself. So if you can type in the chat, we're monitoring the chat, and we're addressing your issues through the chat as well. So let's get started. Let's talk about some do's and don'ts of residency interviews. So we will ask our panelists to talk about some do's and don'ts of residency interviews. Dr. Jetpuri, Dr. Masud, you had some comments on this topic?
Why don't you start, Dr. Jetpuri?
So in terms of residency interviews, kind of do's and don'ts, the biggest thing I would say is anytime you're communicating with the program, whether it's in an official, you're at the interview, or whether it's just email before or after, all of it is just consider that all of your part of your interview experience. And so anytime you're communicating anything with the program, always act professionally, because you never know what interaction they're going to consider and look at when they're ranking you. So that would be just a big do, just always be professional.
Excellent point. I think I would add to that is that one of the biggest don't on the interview is that if never misquote, never misrepresent yourself, never hyper yourself. We would rather have you tell us whoever you are, because if any time you are misquoting and misrepresenting yourself, eventually that will get caught, even during residency, even if you get your resident, and that can lead to you getting off the residency program. So be very careful. We all know that everybody has limitations, so be mindful of that. You want to back and forth, Dr. Jetpuri? You pick one point, I pick one point. So we told the don'ts, but let's talk about the do's also. So
the other thing I would say is just a big do is just sorry, there seems to be
Diana, if you can make the 5 of us as hosts, and so we can mute everybody else, that would be good. Thank you.
The other big
Okay,
sorry, did you have a question?
I think they may be saying they cannot hear us, but as long as we can hear each other, the participants should be able to hear us.
Why don't we keep
Yes, let's keep going.
Another big do I would say is definitely just remember that the program is trying to assess you as a person. So if you get invited for an interview, they've already looked at your scores. They already, they already like you. So really it's a matter of spending that time to, communicate and let them know about your personality, let them feel how you can fit in the program, and also for an opportunity for you to decide, do you fit into their program? Because you're also interviewing them. So you don't want to come off, I would say, like desperate, like, agreeable to everything. If there's something you really don't like about the program, or you're not, you're wanting to know more about, ask about it, because this is going to be 3, 4, 5 years of your life too. A program doesn't want to just hire somebody who feels desperate. And so really take the chance to ask questions and show that you are genuinely interested and you're trying to see if this is a good match.
Do practice giving an interview. You can record yourself. You can have your friend review it. You can have a mentor review it. Don't underestimate how we talk. And I can give you my own personal example. I had a very bad habit of talking too fast.
Excuse me, sir.
And I used to mumble words. I had to practice in front of a mirror to talk slowly and deliberately. Do practice. Do not underestimate
Sir,
the
a
power.
man is writing pickup lines in my inbox.
Please use the chat for any questions or comments. Do not unmute.
All right,
Okay, yes.
let's keep on going. Okay.
I agree. I can't underscore the importance of practicing. I would practice with different people, your friends, definitely record yourself, definitely see how you come off. Depending on how your interview is, some people might have virtual interviews, some people may have in-person interviews. And so it's very important the whole time to make sure you're dressed professionally, even when you're practicing. So you when you're in a suit or in, formal wear, because you may get sweaty, you may feel uncomfortable, and, your shoes may feel tight. All these things can impact how you are on the actual interview day, especially if you're in person. So you want to make sure you kind of go through all those scenarios, kind of the same way you would when you're practicing for a test and you take practice Q-bank questions and you're practicing timing. You want to practice those things.
Do take a moment to breathe. What happens is, I've seen it the last 5 years, people get so excited or nervous, they stop breathing and their mouth gets dry and they can't talk. Take a moment to breathe. And if somebody asks you a question, we don't expect an answer in nanoseconds. Process the question. And if you're not sure, the one thing I encourage all residents, have a glass of water or ask for a water bottle. Take a sip. That buys you time to process that question. So don't minimize the opportunity. Oh, can I take a break? Okay, stop, taking a drip of water and then do that. So make sure, breathe and take an answer. Again, don't be in a rush to answer just because you feel the urge or anything. Or it's a 20-minute dialogue. So breathe and take a sip of water. Please don't underestimate that.
Absolutely. And that just underscores the importance of pauses. So just pause and then talk.
Good.
I would also say do research the program. Make sure you've looked at their website, make sure you're familiar with their mission, their vision, look at their curricula, look at the different things they offer. Look, if they tell you ahead of time who's going to be interviewing you, look them up, look at what they're interested in, because those sort of things, then even if you're not quite sure, how to answer a question, you already have some background information about the program that you can show that you're interested in and you can ask about. So it also looks nice and impressive to the interviewee or interviewer when they're like, wow, this person spent time and, you know, researched us, they must be really interested. So you want to make sure that you've done your homework essentially, and you're comfortable with what the program may offer.
Don't so assume that we have read your personal statement. Assume that we have read your letter. So be always be prepared to talk about, and if you're being asked question for a personal statement, well, there are multiple points other speakers will speak, but that's a do. Always read a personal statement before you walk in. You don't want them to ask a question and you start thinking, what did I write? You know, that is something not good. So that's a big do from that standpoint.
Yeah, definitely be familiar with anything that's in your packet. The only thing you probably would have waived your right to is perhaps the letters. So you don't know exactly what's in there. But aside from that, everything else, you should feel very comfortable to talk to. You wrote, for example, your hobby is, you know, rock climbing, and it's really not, don't lie, you know, put hobbies and interests in there that you can actually spend time talking about, because someone may ask you. I could be a rock climbing enthusiast and say, hey, tell me about the last week you climbed, and you're just like, oh, I don't know what we're talking about here. So anything in your packet is fair game, essentially.
Don't assume that we are trying to play mind games with you. We have specific instructions and specific policies and specific things to follow. We also get evaluated how we conduct our interview. So we are not here to play mind games. We just want to have an open, honest conversation. And again, as Dr. Jetpuri mentioned, the fact that you're invited, we want to hire you. So we want to know you as a person. We are not testing you. And some program may pose questions, some tech, but most of them will not put you in a position to test your knowledge base in depth. We just want to know you, because what we're looking for who can be a good, you know, so just be aware that do not over exaggerate skill. I have personally failed candidates who gave me the impression they're God's gift to mankind. I'm a humble human being. I don't want those people. So be mindful of, you know, if you know everything, then why are you looking for a residency? So just be, and again, coming back to the basic, nothing beats practicing. Record yourself, listen to how you come across. So we all get shocked. We think we are saying this or we have this eye contact. When you record yourself, you'll be blown away how we come across differently. So I just want to be mindful from Safia with our time, so that, you know, we're going to trust you to keep on time, because we got other good speakers also.
Absolutely. So I was going to ask us to move to the next topic, which is common and unusual questions. So let's talk about some common and unusual questions. And let's see, I have Dr. Jetpuri here, and I would ask Dr. Madiha and Dr. Mehreen also to chime in for this question.
Okay. So I had slides, I can share them, or we can actually just kind of talk through them. But you know, some of the most common questions to expect, a lot of them, there's, I would say, think of them in different frame of references. So you'll have questions that they will ask you to get to know you as a person. You will have questions that are considered situational questions. So what would you do if? Those are going to be more, you know, ethical related questions. Then there'll be questions kind of related to more like team working. So kind of to see like, how do you handle things? And so very common questions. Tell me about yourself. I saw one of the questions come up in the chat, you know, how long is appropriate to talk about, tell me about yourself? I would say give yourself about a 2-minute introduction. I think that's enough to keep someone's attention and give them a good brief summary of why you're there, what you're interested in, why you're interested in this program. Why did you choose this specialty? So if you're applying to more than one specialty, make sure you've researched the differences of why you're looking at specialty. Particularly, I would say this is important if you have like a a resume that, let's say you're really interested in OB-GYN and you're really interested in surgery, and you've done a lot of research in OB-GYN, but maybe not so much in surgery, but you're applying to both. That's perfectly fine. But then make sure to, when you're talking about your specialty, you can talk about it and say, you know, I was really interested in OB initially. I did a lot of research, but I realized I want to do more broader surgery, which is why I'm applying to surgery. And I, you know, you can use something that maybe somebody might think like, okay, this person's applying to, you know, because an interviewer is looking at your application and they're going to see, oh, well, this person's got all this stuff in OB. Are they really applying to surgery? Or are they not? And it's okay if you did a lot. And even if you're applying to both, you don't need to tell them you're applying to both. You just tell them why you're interested in their field, and you make sure that you've covered it. Other common ones, why did you want it? Why are you interested in my program? Why did you choose this program? Why specifically this city? So, you know, make sure you, again, this is where researching the program is important. Researching kind of like why, like a certain like city you're interested in. If you have people that live in a certain city, if you know people in that city, this is a good time to mention like, oh yeah, I have family friends that live in this area, or oh, I used to travel here a lot, or oh, I have family who lives here, because then they can see you have like a network and connections, and you have maybe a likelihood that you are going to rank them. Other very common questions: what are your strengths? What are your weaknesses? Perhaps, Madiha, Mehreen, if you want to expand on a little bit of how to best approach these. So I'll kind of leave it to you guys, and we can go through some more questions in a bit.
So definitely strengths and weaknesses, it's one of the most common questions that they ask. Typically, it's seen as bad to list your weaknesses. It's not. You know, everyone who's asking you about your weaknesses, they're human beings. They know you're supposed to have weaknesses. The typical way that I have learned which sometimes when I interview and some students really blow me away, is by how they change their weakness into a strength, actually. You know, some of the weaknesses that I hear are truly like, they're just very humane weaknesses, but they're working on it. They're working on their test taking skills, or they're working. So create whatever weakness that you're going to talk about. Make sure that you also mention how you have worked on it and how you're making it better for yourself. Strengths, to go off of what Dr. Masud said, the strength can't be superhuman. It must be something that, you typically like, that you can relate, the other human being can relate to you. So be humble in your strengths, and don't go down the, I can do everything in the world route. So that would be my take on that.
For me, just to add, I would say when someone does ask you about your strengths, I think it's a great opportunity to highlight the things that you want them to know about you, the things that you are most proud of in your CV, with a little bit of a twist that I love, detail-oriented things. And that's why I took this, this research project from A to B. I love, spending time with patients, and that's why I think I'm really good at getting a great history, or doing a really good physical exam. And, on that note, you can also kind of lead into the weakness. You can actually answer the question about what the weaknesses are, just sort of on that point. As, for example, you can say, because I'm so detail oriented, sometimes that can take a long time. And what I'm doing to fix that is I'm just more mindful, and I'm getting more efficient as I, move forward in my career. So I think you can also sort of gear the conversation in the ways that you would want to highlight.
Yeah. Those are great. That's a great point. Definitely, you can lead your interviewer down a path of questions. It doesn't just have to be question, answer. You can kind of make it into more of a natural conversation. Other very common questions, how do you deal with challenging situations, or how do you deal with stress, or, what are your coping mechanisms? So those are more questions that are aimed towards assessing someone's resiliency. So residency is hard. And so if your interviewer asks questions like that, they're wanting to know, like, have you ever encountered failure? That may also be a common question. Tell me about a time when you failed. Tell me about a time when something didn't go well. And it's perfectly fine to be honest about those sort of situations, because the point of the question is not so much that you failed, but it's what did you do to learn from that failure so you're not going to fail again. And so really that's where you want to focus your answer. So you don't spend a whole 2-3 minutes talking about how horrible it was that you failed. You talk about, yes, this happened to me, and what I learned from this was X, Y, or Z. So whether or not there's something that's very transparent in your transcript, let's say you didn't do well on a class, whether it was one of your steps that you didn't do so good and you had to repeat it again, or whether it's not anything like that, and maybe it's something that happened, with the patient encounter. So have a couple of these, I would say, in your mind, because you also don't want to sound very scripted when you give your answers. And what I mean by that is once you start doing interviews, if you have more than 5 or 6 interviews, if you start saying the same answer over and over and over, by the time you get to your 5th or 6th interview, it's gonna just sound very monotonous and not as natural, just because it's the same thing you've said over and over. And so if you have a couple of these sort of examples for all of these questions, then when it comes time for the actual interview, it's more natural, so to speak, that when you've, you have to pause for a second to think about it, and then you pick one of those to talk about, if that makes sense. I don't know if the other interviewers would agree, but if you use the same story over and over, I mean, some of it, if you're only talking about research and you've only done one research, that's going to be the same. But in terms of experiences, I think it's helpful to have a couple of these things in your head. Another very common question you may encounter is describe a time you worked in a team. So wanting to assess team dynamics, or describe a time when you were a group leader and you didn't agree with, the way your team was managing things, or describe a time when you were a team member and you didn't agree with the team leader. So this is more assessing conflict. And so again, wanting to see how you as a resident would work in a group setting. Are you teachable in the sense that will you listen to people's feedback and criticism, or will you bring up something if you see an error? Because one of the things in medicine we want to do is make sure we avoid errors. And if we catch something, we say something. So making sure that you feel comfortable bringing those things up. And so those are kind of like bigger context type questions you'll see very commonly. And then, like I mentioned earlier, describe an ethical dilemma you faced, or maybe, there'll be some sort of situation around that. Maybe they'll ask you a situation and then it's an ethical situation and you have to kind of talk about how you would, handle that. Maybe they ask you about what if you saw someone cheating. Maybe they ask you about what if you saw someone using, a patient's medication drugs and lied about what they put in the chart. So there'll be some form of an ethical type of question that either they'll ask you how to respond to, or they'll want to know if you've ever encountered this and how you should. I would say it's important to also practice through some of the scenarios that people, that you've encountered and seen. You don't want to sound overly negative and overly, what's the right word? Like that you were right about the whole situation, because if it's an ethical situation, there's always some gray and there's different ways things can be interpreted. And so you want to make sure you express an even response, but something that shows that the difference between right and wrong, and you would speak up if there was something wrong. I don't know if any of you guys want to expand on any of that or bring up any other common questions.
And these questions are basically asked to get you comfortable with having a good, friendly conversation with the faculty and with the PD. Also, don't have rehearsed answers for all the questions they're asking, because they want to get you out of your comfort zone of the practiced interview and see how you would respond spontaneously in a situation. Okay, let's get moving to the next agenda item, which is etiquettes of virtual interviews. So let's talk about etiquettes of virtual interviews. I think Dr. Mehreen Khan, you were going to talk about this.
Absolutely. So virtual interviews they're new, or they were new a couple of years ago for everybody, and it took a couple of years for everyone to really get used to them. Most people are still not used to them, but there's some ways you can take the virtual interviews and use them to your advantage. The do's, I'll go with first. You have to be on time. since it has gotten virtual, there is no excuse for anyone to be late to these. So make sure, like, on the dot, if not a couple minutes before you log in. I would highly recommend checking to see if your mic is working, if your internet is working, if you have good lighting, you have a good, camera. Those are going to be essential because you have a little bit of time to impress whoever you're talking to. So you don't want to waste that in trying to fix some technological issues. The other thing is being very respectful to the person who you're talking to. That means that you are making good eye contact, you're dressed to the best, you don't want to, you want to wear things that show that you respect that you took this person's time, and you want to talk to them. You do have to appear like you want to be there. And I only say that is because I've had applicants who didn't seem, I don't know what they were going through at the time. And I can sympathize if there's something going on, but if they don't appear like they want to be there, then I don't know what else to do. So you have to be a little bit happy, and your affect needs to kind of match theirs. If they're smiling, you smile. If they crack a joke, laugh a little. So do that. Make sure that you're in a quiet place with no distractions, so there's like not loud noises in the background. The don'ts would be, honestly, there isn't much don'ts. It's a very good strength to be at a virtual setting. You can help yourself with, having a water next to you or whatever you need to drink next to you. And I saw someone in the chat asking if that's respectful to take a sip of water. Absolutely. You're a human being. They're humans. They know you can get thirsty. You can take a sip of water. Don't eat, your lunch while talking to them, but you can sip water. You can put little sticky notes for yourself around your computer to like little talking points if you get nervous and you forget. I do that. I get nervous and I forget everything that I prepared. So I put little sticky notes around my computer to remind me. I remind myself to sit up straight too, things like that. So you're in a really comfortable environment if you think about it. You're at your home or somewhere that you're familiar with, and you are just going to be comfortable and be yourself in that environment. Big don't, and this has actually happened, don't be on your phone. And it's easy to think that, oh, I'm behind my computer and I'll just look down at my phone and nobody will notice. Everybody notices. They can see the light pop up. They can see you looking down over and over again. So please don't do that. It has happened. It doesn't look good. It doesn't matter how engaging you are. If you are distracted, that's very disrespectful. If an emergency happens, that's understandable. You can tell them, hey, it's an emergency. Someone texted me, and is it okay if I just take a quick look? And that's, that's understandable, but just don't be texting while you're talking to the person. Typically, your interviews are going to be very small snippets. So we'll only give you 15 to 20 minutes with each person. So it's gonna go really, really fast. It's burnout, residency, or the Zoom burnout is very common. You kind of get tired but it's so important to remind yourself that this is a new person I'm talking to. So I still need to be as excited as I was with the first one, because all of them are gonna sit together afterwards and talk about it. So I think those are the only ones I had for.
Dr. Madiha Khan also had some pointers on this.
Yeah, and my pointers are more technical too. For example, a lot of people stress about what do I put on my background? And I think as simple as you can go, that's better. If you can even blur your background or have one of the Zoom sort of virtual backgrounds, if you don't feel like yours is, cutting it enough. But, overdoing it, I don't think that's really something that interviewers really, pay too much attention to. I know some people are like, maybe I should have this very specific painting that someone will ask me about. I can pretty much guarantee no one's going to ask about it, because it just goes, we're trying to focus on you as the applicant. Unless it's like, a family picture, sometimes that does come up if that's natural, but I just wouldn't stress too much about it. Do try to make sure you're in a smaller room so the acoustics are better. And you can use your AirPods or whatever you like, but regardless, it'll help sort of the sound. And have your phone as a backup. There's a little stand that you can get. It's pretty cheap, like $10 on Amazon. where that can also act as your new sort of laptop if should things go wrong. And hopefully they don't, but just be prepared for any sort of technical difficulties that may arise.
So I'll add one point if that's okay with you, Safia. I think Mehreen and Madiha brought up very good points. And it can become tiring. Our shoulders and neck may become stiff, when you're doing back to back. So that's something to be aware of. It's okay to stretch. It's okay. We are all human. If you are on Zoom, believe me, I'm on Zoom also. And you can glaze off. So and have gentle lighting, because sometimes blaring lighting, can tire your eyes. And if I'm watching your eyes and you start blinking too much, so I'm not sure, is it the light or you're nervous or am I catching you something? So be aware of these things. So these are subtle things, but in the world of Zoom and all of these things, these are very relevant. Also, I would say that if you are conducting an interview from a smaller town or out of the country, you need to know your limitation of the bandwidth. Interview web bandwidth, because that can sometimes be a struggle of that one. We just be aware of it. And again, we all know it can be challenges. Just say that, but be careful of your bandwidth of video link, because video, again, this is a lot of data streaming, so be mindful of that.
Okay, let's move on to the next thing on the agenda, communicating with program personnel before, during, and after the interview. So if any of you would like to take on that question, Dr. Madiha Khan, we haven't heard a lot from you.
Sure. Every communication that you have with the program, from your interview invite to, the follow-up email after, that is part of your interview and you should consider it so. When we start sort of evaluating applicants, we do think about, that person did send us an email and it was a very nice, thoughtful email. They mentioned people by name. They seemed very engaged to talk to this or the other resident. And so that's a very sort of thoughtful interaction. And so what I would sort of recommend is make every interaction that you have, from the person that is scheduling your interview to the person that's moving you into the different rooms on Zoom, make them all professional and very sort of genuine. Especially when you are interacting with other residents. They do take this into account. They want to be with someone who's going to be a really good fit for them. And if someone's really not, jiving right, or asking sort of strange things that maybe are already addressed, seconds ago, or aren't really applicable, that's something that does stick out, unfortunately, as well. And so communication, whether you're chatting on the side chat or asking the questions, just make them thoughtful. And I think that should really set you up for a positive outcome.
I'll add one thing to Madiha's point. When you're interviewing, you assume that you're only interviewing with one person. As selection committee, we all talk. Okay. And you may not have one good interview with one person, but that's not the end of it, because that's one interaction. If 4 others went very well, though, we do take that into account. So any one of us can have a bad, and not bad or not as well. So don't underestimate this is the end of the world and oh my God, I messed up, and now you're mentally, psychologically down. Remember, there's not only one person interviewing, there are multiple opportunities of people interacting with you. We all talk. Don't assume. We all share communication. We are all more open than you suspect. So we're not hiding good or bad both. So just be aware of that.
And then after the interview, you want to make sure you send a thank you note to everybody who interviewed you. It could be handwritten, or it could even be an email. That's perfectly fine. But as long as you and not a generic one either, just, something that, you can remember from your conversation. So if you can personalize it, it actually, makes them remember you even more. So, for example, oh, I really appreciated the question you asked me about this, or I really enjoyed our conversation about, this. So that way, again, another way for them to remember, oh yeah, we talked about this. Oh yeah, I really like this person. Oh yeah, this person was very thoughtful. The other thing I should mention is some programs offer second looks, and second looks are more for you, not for the program. They're not allowed to use second looks as part of their ranking process. However, that being said, is if anytime you're in front of a program or talking to a program, you also always want to be professional. It doesn't matter if they've already put in their rank list or not. Don't give them an opportunity to go back to their rank list and change it because of something you did on a second look. But the second look process is really for you to get to know the program. If you really wanted to get to see them, let's say it was a virtual interview, now you're getting to go in person, but also is not limiting. So just because you didn't get to go to a second look for a program you really wanted to, that's fine. Programs cannot use second looks on how they rank you. So just keep that in mind if that opportunity does come, and either way, if you're able to go or not able to go, just make sure you're professional if you are in there, because anytime you interact with the program, consider it part of an interview.
I'll add a couple of points here too. Always be polite in your communication with any and every member of the program team. And the other thing was, and now I forgot. So be polite, be honest, and keep your communication short. We occasionally we receive letters from emails from IMGs who write extensive emails, and they're just asking for an observership or an opportunity to work with us. Just be direct, be to the point. Don't write extensive emails, because that's not going to be kind on your part. Anyone else with any comments on this topic?
One more thing, Sahaswa. So, I commonly run into this terminology issue. People interchangeably use clerkship, observership, elective. When we're like, there's a very different connotation. Elective in the way, and again, you all can chime in from our standpoint. Elective mean that we have an official affiliation with your medical school, and you actually officially rotated as an elective. That's when if you don't have an official relationship with an institution, it's you can't call it elective. Observership stands by itself, and clerkship can be more, but be mindful because people interchangeably use these things. And so I just want you, and especially even when they're applying to do those things, be mindful, because you don't again want to misrepresent yourself or be not counted. So clerkship, observership, and elective, these are very specific terms. So be mindful of interchanging these things.
Excellent point. Let's move on to the next one on the agenda, questions to ask the PDs and other faculty. So you have the opportunity of asking questions. So first off in the interview is introductions. Next, they ask you certain questions like tell us about yourself, or certain programs will ask you patient-specific or ethical questions like Dr. Jetpuri mentioned earlier. And then they will ask you, do you have any questions for me? It is okay to ask the same question from all the faculty. It is good to have multiple different questions to ask. Stay interested in the program, show your interest by asking good questions. And I'll have our panelists also expand on this. So what questions should the interviewees ask?
So yeah, I would, ask them to, if you've done your research on the program, then have a couple things that you want to know more about. So let's say you want to know more about their wellness initiatives. Maybe you want to know more about opportunities to do extra procedures. Maybe you want to know about how they train on certain robotic surgeries. And so, a question to ask is tell me more about and then something you've researched. And so if you've looked up a couple of things, it's good to have notes. You can have notes and refer to them. That's completely fine. The post-it notes are, if you're doing a virtual interview or on a paper that you look down and look at questions. It's completely okay to write points and questions during the interview. You can explain and say, I'm keeping notes if that's okay, just so they know why you're looking down or why they see your. Other questions that are good and appropriate to ask would be like, what changes do you expect in the program this year? What changes do you expect in this institution in the next 3 years? What are you looking for in a candidate? It's perfectly okay. Like, okay, tell me what would be an ideal resident for you. Also, like, what do you like about this department? What do you like about, why have you been in this institution for as long as you have? So, and again, these are questions we can ask of multiple interviewers just to kind of get a sense of, is everybody feeling the same thing? Or, if somebody says something's changing and someone says nothing's changing, then, there's a little bit of a discrepancy too, because again, you are also interviewing them. I know that it feels like only you are getting interviewed and this is so high stakes, but you also have to realize programs really want you. And so they are also trying to sell you their program when you come to interviewing with them. So you also should approach this like, I am interviewing them. I want to make sure that this is the right program for me and that what they're doing is transparent and what they're telling me is honest.
I will add to that on building what Dr. Jetpuri mentioned. So as you know, the matching program works as a basic principle is that the program rates the candidate high and the candidate rates the program high. So both have to match. So by you asking question, and your questions are very good questions and come across good, they intuitively know that you are really taking time to know about the program and you're more than likely will to rate them higher. Okay. So if they want to rank you higher, they want you to also rank them higher. So it has to be, these are all subtle signals which gets communicated indirectly. Because if you don't ask question or you ask very superficial question and you're an excellent candidate, my gut feeling will be, you know what, this guy is too good for my program. He's not going to rank me higher. So why do I really want to waste all of this stuff? Wise, I know I'm giving the insight we are not supposed to on all the stuff wise, but those are the processes which come into evaluation. So it's a meeting of the minds and really trying to have the best match. So having thoughtful, good questions shows me that you really are interested in coming to my program. I'm going to more than likely rate higher.
And always ask questions. If someone says, you have any questions to ask? The thing that bothers me sometimes is when people say, no, I have no questions, or I've asked everything. Kind of tells me like, okay, all right, thanks for not being interested. All right, I don't know if I'm interested in you. But no, really, even if it's a question that everybody's asked, you can say, I've asked this question of multiple interviewers. I think I have a good understanding, but I want to phrase it to you instead. So if you've researched the program, you have a couple questions, have like 5 or 6 or 10, up to 10 questions you would like to ask. And this way, you're not necessarily asking the same question, but always ask questions if there's time. Sometimes you're not going to have time. Maybe you only had 15 or 20 minutes and you ran out of time. Then it's okay to ask questions later and say, there were a couple things I wanted to ask, can we communicate over email? And that's perfectly fine too.
Great points. Let's move on to the next topic, which is not exactly related to the interview directly, but it is definitely related to the interview. Personal statements and letters of recommendations. So let's hear from everybody, from all the panelists regarding personal statements. What do we want to hear from the applicants in the personal statements? Dr. Mehreen Khan, would you like to start? Yes, Dr. Masud, go ahead.
Oh, no, go ahead, Mehreen. Mehreen, you start. Go ahead, Mehreen, you start.
Sure. I think that the simplest and the easiest answer is we want to know the truth, and we just want to know who the person is. So typically personal statement, most of the time, whoever is interviewing you, that's the only thing they remember. They don't remember your CV, where you graduated, when you graduated, what did you do. But they typically, before they interview you, they'll quickly glance over the personal statement and see what to get to know you. So if it's a good personal statement, they get to know you right away, and they already know you before you start talking to them. If it's vague or it's very generic, then they don't really know anything that about you. They say that it has to be super interesting and catch an eye and whatever. That's to get you an interview. Once you have the interview, that personal statement it's going to be the same one, but it's going to really pop out and get that person to remember you. So you being yourself is the most important thing. Not putting something in there that didn't happen, because I promise you're not going to remember what you wrote in there if it's not true. And then they're going to ask you about it and you're going to be completely blank. So if you're telling a story, make sure that it actually happened. Those are my 2 points on that.
So on the letter of recommendation, never ask anybody a letter of recommendation unless they personally know you and are willing to write an excellent letter of recommendation. The letter recommendation in US, it carries a heavy weight. And our reputations are on stake. So, and let me tell you one point. This may be obviously your one time or two times applying for residency. We all have been doing for multiple years, and we've seen hundreds of letters and hundreds of things. So we can pick up signals, and the people writing those also can communicate signal. So be very, they need, if it's not personal, then it's a generic stamp on. Okay, I know you're good, but you're not makes very good or something like that. So that's one very important point wise. The one thing I will tell you is that that some of the letters which we see from especially people from overseas, every letter show that that one candidate is God's gift to mankind. You can't be the Nobel laureate. All right. Everybody from overseas can't be a Nobel laureate. So the letters of recommendation have to be really meaningful and very personal. So that's on the letter recommendation. On person statement, absolutely address your challenges if you had. Whether you had low score, or you took 6 months off, or you had some health issues, or you explain. We all are human. We all have challenges. If you don't hide behind an issue, I would rather you address issue. I've had candidates who took a year off because they had some family tragedies and they took off. Okay, they explained beautifully. Some residents say, well, I started in medicine, I'm going to surgery, or I started this, make a case for it. Why not? And believe it or not, to me, that is very powerful. So, address who you are. And the more personal it is, the more meaningful, impactful it is. And I've had program directors and sometimes had tears in their eyes because they were so meaningful and impactful. So take the personal statement very seriously, take the letter recommendation very seriously. Assume most of us will be reading it, and assume we will be asking questions coming from that. Because remember, we have a certain time we want to know you, and nothing beats than the letter, the recommendation, and your personal statement.
And again, stay humble and stay honest in your letters and any communication that you make with the program. Be honest, be humble, and kind. Don't sound desperate. That was another thing. In your personal statements, in your communication with the program, don't sound desperate. Nobody wants to be with a person who's not an optimist, who doesn't have a positive vibe coming from them. So be positive. If you sound desperate, then the program will likely pass on you. Dr. Mehreen, you were going to say something?
No, I agree with everything that you talked about. Staying humble is just so important. That's the biggest turnoff when someone is not humble. I mean, everyone wants to work with someone who they're going to work with you for at least 3, 4, 5, 6 years, depending on the specialty, and they want to be with someone that they can actually work with. So show yourself to be someone that's a team player who can work well with everyone else.
The letter recommendations doesn't have to be from US. I just want to be visible. The letter recommendation, we are really looking for people who have personally can give anecdotes or examples or kind of say why, sort of thing, why. So think, that doesn't have to be US-based physician. Just be truthful and be person who knows you. So that's keep it in mind.
Okay, and then in the chat, we have, I think we covered most of the all of the agenda items. So we can address the questions in the chat now. A lot of you are asking about, is that program IMG friendly? Do they take DOs? Those are questions specific to a program, and I would encourage you to write to the program coordinator for those specific details. And that will give you the best answer. I don't want to, give you information that's not correct for a program that I'm not part of. Other questions in the chat are, so some of those have been addressed as we're going, as we're having this discussion. Let me actually go through the chat, look for questions specifically, and I'll ask the panelist to kind of chime in and give us some more pearls regarding interview process and application process. There are questions regarding one-on-one mentoring for interview practice. it would be best to reach out to your alumni and have the alumni work with you on one-on-one interview practice. You can enroll or sign up for become a member of AMWPA, and then we can assign you with mentors who can guide you through this process and also work with you for one-on-one interview practices.
We didn't touch on too much uncommon questions. And so just, uncommon questions that you may see, but you should also expect would be things like, what food describes you, or what cartoon character are you? So they may ask you, just to kind of essentially, this is looking at wanting to describe your personality. You may get asked a question about, how do you stay updated with medical literature? Or tell me about the most recent article you read. Tell me about the recent book you read. Especially, again, if you put something in your interest about reading books or reading things like that, you want to make sure that you have something to tie it to. Particularly in the hobby section, anything you say, like, I love baking, make sure you've recently baked something that you can talk about, that. So whatever you put in the hobbies, make sure you have some sort of story or description that you can talk about it. They may ask you just to explain your research, describe your dissertation. I don't know how much detail, it depends on the different types of programs. A lot of the specialty heavy ones may want you to talk more about those sort of things, especially if you have a lot of those. So again, make sure that if it was something you were meaningfully involved in, that you listed on your CV, that it's something that you are able to talk about. Once in a while, may actually get asked to talk about a clinical scenario. How would you respond to a clinical scenario? How would you, do a certain procedure? And so again, if it's something that you are applying for in a certain specialty, you want to make sure you're comfortable with that.
So, depending on your strength, candidates can have a very heavy research strength. They can have very clinical strength. They can have very strong academic strength. So some of them have a mix of it. But if there is a specific your own strength, be ready to be asked questions about that. Okay, because we want to verify and validate your really true strength also. The other aspect is that I see very frequently is that people would have done research or publication in one field, yet they're applying into a very opposite field. So I want to understand, okay, you did research and you did all of the stuff in this area of medicine. Why are you applying to, why? So people may be doing a lot of research in primary care, but now they want to apply to anesthesia or surgery. Help me understand that. So I will ask you a question on that.
I'm trying to answer as much questions as I can in the chat, but one thing that is popping up over and over is year of graduation. Want to touch base on this. I do think so. Year of graduation is for most programs, it's a GME requirement, which is a graduate medical education that sits on top of each specialty. So a program can have multiple specialties, and then they have one graduate medical education on top. So those are the ones that are actually, creating these measures. Correct me if I'm wrong, but they're pretty rigid from my understanding. If there's a cutoff at 5 years, the applications get cut off at 5 years of graduation. So in most of these programs, these requirements are mentioned on their websites. And if they're not, you are more than welcome to email them and ask the program coordinator. But typically this information should be on their program, and you can kind of check to see which programs are more appropriate for you.
I think Mehreen brought up a very important point. Very frequently we see candidates who are excellent candidates, but because of whatever personal or family issue, they're applying after 5 or 6 years. I just caution them that over a period in the last few years, most of the programs are becoming much more stricter about how far ago the person graduated from the medical school. So they're not as open and accommodating as they used to be in the past.
For foreign grads, if you can take step 3 as well before applying, that really sets you above a lot of other even local grads who have. So if local grad has multiple fail attempts on USMLE versus IMG has pass attempts and has taken step 3 as well, it will give you an additional bonus.
Safia, any major topic which has not been addressed, which is already in the chat that we can help address
So
coming up?
let me look at, so we talked about common and uncommon questions, do's and don'ts of residency interviews, etiquettes of virtual interviewing, personal statement LORs, and communication with the program. In the chat, we have some specific questions that are being asked, like visa issues. So if a program has invited you for interview and you will require a visa, it means that the program is willing to sponsor your visa. So don't consider a visa as an obstacle to your being ranked high. So if you've been invited to the interview, that means they have looked at your application and they have overlooked any faults or weaknesses that you may have in the application process.
So I'll read one or two questions if it's okay with you, Safia.
Sure.
There's a question in the chat that I heard that if you send 4 letters of recommendation when the program have said they only required 3, would that be a negative point or considered bad? Well, you know, my always a routine answer would be what the program wants to last, give them. You know, by you sending them a lot of extra letter recommendation, that means you're really not paying attention. And that creates more chaos for the program coordinator. And that just don't do that, you know. So, you know, pick the top 3 and then send it to them. Be sending them 10 letters of recommendation is not going to make you a more better candidate than somebody who just sent 3, you know. So just stick with the requirement with that.
Another thing we occasionally see with LORs is the applicant will be applying in multiple specialties, and you're interviewing, or for example, I'm looking at family medicine applications, and the LOR clearly states that this person would be a great applicant for your pediatric residency. So that tells me you're also applying for peds, and likely I will not consider you for family medicine. So if you can ask your letter writers to be specific and to be careful, like for example, if you've worked with 5 people, ask 3 of them for pediatric letters and ask the others for family medicine letters. So there is no confusion, and because that will really affect your application and your chances for getting interviews. Generic letters of recommendations are fine. They carry equal weight to specific letters of recommendations. But if it's a specific letter sent to the wrong specialty, that will not help your application. Sometimes in home country, you've done your training in surgery or OB-GYN, and then you're coming to the US and applying to family medicine or internal medicine. It's not going to be a problem as long as you explain that in your personal statement. And then there's a question asked, can an IMG enter directly into a fellowship program without ACGME accredited residency from US? Unfortunately, actually, no, there's 2 answers to this. There are some programs that do take you, but those will be non-ACGME accredited fellowship programs that will take you without an ACGME residency from the US. And so the plan for those programs is that you will train for fellowship and then you will go back to your home country and practice that specialty. If it's an ACGME fellowship, they do require that you have licensing or you're eligible, board eligible for your primary specialty. And then they will accept you in the fellowship training.
You know, Safia, one more thing on that. Even for the non-ACGME, if you are taking care of a patient, operating on them or taking care, you should be able to be license eligible. You should meet the debt. So that is very state dependent. So you want to know, you know, what is the state requirement for life? And there's a whole, every state is quite a bit different. So you want to know the ability that is the institution be able to sponsor your license, and there are ways to do it also. So if you want to go directly through ACGME, non-ACGME, you always want to know about the licensing issue, because if you can't get a training license, you know, they can't do it, whether you are ACGME or not, they can't allow to touch the patient. So licensing is very crucial, and you want to know that.
Another question asked is, I have done residency and fellowship in my home country. How do I convince or answer the interviewers that I'm willing to start all over again and I'm trainable? Again, you have to highlight your strengths of being flexible. being able to learn from people who are younger than you or maybe more junior to you in practice years. So you have to be an open, you have to go in with an open mind, show them that you are willing to take negative and positive feedback from others, and that you're trainable, basically. You can also start with, medicine is a profession where we're always learning. So.
But I would add to that is that I want to know why. Why are you even coming? One can say, well, the most common thing is, economic reason, or I'm not getting growth wise. I just want you to make a very compelling case that why are you even coming? Because I've got fresh graduates, local, and I want to take the slot to give to you. So there has to be a very good case for that. Why? And what are you going to contribute over here? Because remember, one thing I want to make sure people recognize that this is not one person decision. There's a committee which sits and ranks everybody. So you have to be able to impact most of the people, not 100% every time, but it's a committee. It's not one person.
And then regarding communication with the program, some folks have asked if it's okay to send email of interest. I would say I am for communication with the programs. For example, if you have a permanent address for California and you're applying to Florida programs, I want to know if you're going to move from one coast to another. So if you have sent me a letter of interest, then I know that, yes, you are willing to go that extra mile and move from California all the way to Florida. So sometimes it does help in letting them know that you're not just sending an application, you are truly interested. And in that interest email, you can say that you have family there or state your reasons for your interest in a program so far away from home.
One more thing, I know Safia is not directed towards this interview. I do want to, because I frequently get, emails, calls, personal phone, about graduates who are fantastic candidates, fantastic doctors. They're just too long a time by the time they're at residency. I would highly encourage people that, there are other venues in this country to excel in medicine. There are multiple other venues. And interestingly, some of the people go very high in that way. So there are more ways of practicing medicine, may not always be hands-on. So think about these things and keep that in mind, especially this is for people who have been, 5, 7, 8 years out of a medical school. And for whatever, reasons they could not start their residency, there are other opportunities, other venues. Don't close all doors, or don't be, or, that, oh my God, if I can get it, my life is over. No, you're very smart. You're very smart. You put in a lot of effort. There are other venues also. So sorry, it was not directed to this interview, but there are people who are posing some of these questions.
I agree wholeheartedly. I think we get to this point, which I hear a lot from applicants, especially international medical graduates. They just feel like they're sort of what we mentioned earlier. They get into that desperation phase, but at the same time, they want the best of the best to come their way. It's important to have an open mind, know your value, know that you are a doctor and you have a lot to bring to the table. But at the same time, whoever is interviewing you, they also have their requirements and what fits their program and whatever set of rules they have to follow. So you have to kind of take these two things together and create a balance and be able to accept programs that are they're willing to take you and they are going to value you and your knowledge and who are going to make you the best doctors. And so be open to areas and be open to programs that may not have like a really big name, but are going to make you excellent doctors. So, but at the same time, value yourself. That's going to be very, very important.
Another thing, particularly for IMGs, I would recommend that you learn another language, especially the second language in America, which is Spanish. Learn that language, be able to converse in that language so that you can add it to your CV. Some questions regarding research. So any and all research counts a lot. Presentations like poster presentations or oral presentations also carry a weight. So be involved in those and mention those in your CV. Research is also a great way of entering into academics in the US, especially for old grads. It's a very good way of, being able to practice medicine without seeing patients.
Now, I will tell you that if you did research for 3 years and you did not do any clinical interaction with the patient, I would be a little bit concerned that you have been out of touch with hands-on medicine. So even if you're doing research for 2-3 years, figure out some way to interact with patients, because I've had candidates who did 3 or 4 years of research, but they never interact with the patient. I start getting worried, and not when I say I mean a lot of us getting worried that this patient last time interacted with the patient 4 or 5 years ago. Does the patient still has clinical skills? So in a doctor's life, that can be meaningful. So just keep that in mind that, if you're doing 2, 3, 4 years of research, make sure you're hands-on engaged with the patient somehow or the other. Don't underestimate, that.
Okay, with that, we have about 2 minutes left to end our meeting. It was great talking, points from everybody. Please let us know if you have any questions. You can go to amwpa.org website, be a member of AMWPA so that you can directly contact us. Any closing comments from our panelists?
No, thank you all for listening. Just look at that, most of us came as IMGs over here, and, hard work pays off. Don't be turned on by first no or second no. These are, I jokingly say that most of my colleagues who came 30 years ago probably will not even make it to the interview. So this is an ever evolution. And, the last point is that the journey to go to whether US or Canada or UK should start in your medical school. You gotta set the stage, because then you build up your resume to that journey. If you started after you graduate, people have done much more than you. So keep that in mind, and good luck with everything. Thank you.
Yeah, I would say, you picked medicine because it's not an easy road. It's never going to be an easy road, and no one's road is going to be the same. And so just because you didn't match the first time you wanted, or the second time you wanted, or even if you've experienced failure, all of these are experiences that shape you. And so just persevere and keep at it, because that's what medicine is about. And so, inshallah, everybody will match where it's meant for you guys to land. Thank you for letting us speak with you today.
Absolutely. It's an honor to talk to you guys and answer your questions. We've all been through similar situations. We know how hard it is. Please don't forget to value yourself. Know that you have already made it to a point where you're now applying to residency, so you are doctors and you are powerful, and be able to know that you will be where you're supposed to be. Whatever you're supposed to do, no one can take that away from you. So be kind to yourself and be kind to others and be respectful, and that's all. And then you'll make it.
Thanks, everybody. I am posting an email address. It's amwpa.sec@gmail.com. You can send your questions to AMWPA through that email, especially if you're interested in one-on-one interview preparation. We can help you with that. Thanks, everybody. Good luck. Thank you, especially to our panelists, and thank you to AMWPA for giving us this forum for this excellent presentation. Thank you.
Thank you all. Have a great weekend.
Facilitating.
Mhm.